Welcome to the 54th Directing Council here in Washington, D.C., Pan American Health Organization's annual meeting where we talk about very important issues. My name is Derek Fromson. I'm Director of Communications here at the Pan American Health Organization, and I'm here to present Social Good this morning to you. Social Good is a global community where connectors come together to share world-changing ideas and spark action in our social media era. Since it was founded in May 2013, more than 400 events have been hosted around the world, from a Google Hangout at the base camp of Mount Everest to a global summit in London. The Social Good community consists of more than 45,000 fans, followers, and members from 145 countries. Social Good has co-hosted several events with PAHO, including last year's Directing Council, working together to open a dialogue around health in the Americas. Social Good is the brainchild of the UN Foundation. We at the Pan American Health Organization send a special thanks to the UN Foundation for their ongoing support and collaboration with this initiative. Unfortunately, the UN Foundation could not be with us this morning due to the ongoing UN General Assembly in New York. Of the many important issues we're going to be talking about this morning, one of them is the Millennium Development Goals and Sustainable Development Goals. And one of the issues that we're going to be talking about with that is that the MDGs come to an end with a lot of really good regional progress that's reflected in PAHO's regional report. The new UN Sustainable Development Framework renews the agreement of all nations to a better world by 2030. One of the 17 Sustainable Development Goals is on health, and PAHO's member states and secretary has contributed to shape it and make it a standalone goal. Here with us today to talk about that is Luis Augusto Galvao, who is the Chief of Special Program Sustainable Development and Equity Health for PAHO. Welcome.
Thank you very much, Derek. So, welcome. Thank you very much, and I want to say hello for all this audience, and it's a pleasure to be here with you.
So tell me, we refer to Luis Galvao as Guto here, so just so you know, what is the status of the MDGs, and what is PAHO doing to celebrate the results?
So we have very good news in terms of MDGs in this region. So actually, we made tremendous progress in all the MDGs related to health, and also in the others that somehow interfere with the health MDGs. But there are some challenges. So there are the challenge of maternal mortality. That's something we still are struggling in the region, and there are this challenge of it's not a homogeneous process. So inside the country, there are still some areas where MDGs are not achieved equally as the other regions. So we need to continue work on that. And actually, in the SDGs, some of these MDGs are still there and will continue to be one of the global development objectives and targets.
And what are we doing? What is the Pan American Health Organization doing regarding the new Sustainable Development Goals?
So for the MDGs, we prepare a report. Yeah. This is a report. So actually, it was a joint project, and we have all this what is being achieved on the MDGs, and this is very important. The other thing we did is we make an analysis and compare what is existing already in PAHO in our system. So what is already planned, budget, and is in implementation at country level, and compare that to what is the new SDGs. And the result was quite enthusiastic and quite positive. So we really are well prepared for all the new SDG on health, the SDG 3, and its 9 targets and 4 means of implementation. We have mandates, we have activities, we have strategies, we have technical programs in all of them. So we are very well prepared. And now we ask countries, and actually our director, Dr. Carissa Etienne, sent a specific letter for the Ministry of Health asking them to have a regional national consultation to discuss it and get prepared for January 1st when the SDG starts. SDGs is different from MDGs, it's much more ambitious goal, it's a much more ambitious initiative, but actually I was in New York last week, and I see so much enthusiasm, so much interest. So I think it will be another important milestone.
I'm glad you mentioned that, because I was going to ask you. You were just in New York for the UN General Assembly last week. And what is it you heard? What did you see? Any surprises? Anything that you thought were the things that might change our thinking or support our thinking?
I think there are three, maybe I can mention three important things. There are many, but the three I can. The first is see in reality a process that is driven by member states.
Sure.
So we see that the secretary there is really supporting, but the member states is taking the initiative and pushing forward this sustainable development goal. It's nothing, it's real. It's big, it's real, and people are very enthusiastic, maybe more than the MDGs, because that's a fact much more looking forward, a better world and all that. Second is the implementation. So now, and nobody wants to talk more about what is this or not. Really the focus now is how to implement it.
Sure.
And there are many sessions I participate where they are actually reviewing what is already being done in the countries in advance. Just an example, in our region, Colombia already make the national plan sustainable. So they are already implemented far more than others. So it's and there are good examples out there. So we see other examples like Sweden. One of the meetings also talk about that. The Queen of Sweden actually called many presidents and signed a declaration to support the implementation. And we have the President of Colombia, the President of Brazil, and Trinidad and Tobago signed together. So his region is present there, and others is now going forward. The third I want to mention is the challenge of measuring and monitoring this. So we do have a ongoing process that started actually a long time ago and go until March next year to establish the indicators. And the indicators, how we measure all these enormous challenges, 169 targets. So how you measure that and how you measure the impact of that in equity, and that will be the big challenge ahead.
Well, that was, again, leads to the next question in terms of what tools do we have to facilitate this process? So are you going to, in terms of measuring, are you going to have benchmarks during the next 15 years to kind of at different points along the way between now and 2030 to really look at how whether it's successful or not?
We don't know exactly, because this process is going to until March next year to really establish the details. But what's clear now is the way they approve the SDGs need to make sense for countries.
Sure.
So I saw an example interesting. It's like before in MDG you have like a mozzarella pizza, so everything is the same and we compare the same.
Sure.
Now each country will pick which is important for them.
Sure.
So it's like a mixed pizza. So you have several slices. One is a Hawaiian, the other is Calabresa, and then you need to see, how you compare this slice in terms of the integrity of each slice. So it's a total different process, and will be the idea, of course, is like it was in MDG, every 5 years, have a stop and look forward how we can improve that. But there are big methodological challenges ahead.
Now you're making me hungry thinking about SDGs. I didn't think that could make that correlation, but that's...
Actually, one of the most important SDG is on nutrition. Dr. Etienne was in New York actually addressing it as a big, big audience, and she was making the case as how important is on the link between health SDG and the others SDG, particularly, those with nutrition, poverty, climate change, and others.
Sure. Great. Well, Guto, thank you very much for this explanation on SDGs and MDGs, and I know we have a lot of work ahead of us during the next few years, next 15 years to be exact, but certainly between now and March. And you've been a great asset in helping us get there so far, and looking forward to continuing working with you on this.
Thank you very much for the audience, and we are ready to go.
Our next topic is going to be on it's violence against women. Approximately 1 in 3 women in the region report physical intimate partner violence or sexual violence by any perpetrator during their lifetime. Violence by an intimate partner is the most common form of violence experienced by women. In addition to being a human rights violation, violence against women has long-lasting and profound consequences for women's physical and mental health, which are often overlooked and underreported. These include suicide, HIV, AIDS, STIs, maternal mortality, among many others. There are compelling reasons for a specific focus on violence against women. Here with us to speak more about it is Alessandra Huedes, who is the advisor for intra-family violence here at the Pan American Health Organization. Welcome.
Good morning.
Morning. So Alessandra, what is violence against women and how is it different from other types of violence?
Sure. So I think that we have to start by saying that all forms of violence are unacceptable and that there is a role for the health system to play in addressing whether it's violence against children, violence against youth, etc. But there are specific characteristics that you alluded to in terms of violence against women, which really requires a different focus. So to start, violence against women is often invisible, right? Because it's not part of the national statistics. And so if you look at a country's national statistics, violence against women will not figure there as it is. However, it's linked to maternal mortality, HIV/AIDS, unwanted pregnancy, etc. The other reason is that it's a form of violence that's commonly socially acceptable. So whereas homicide, for instance, is unacceptable in any of its forms, many forms of violence are deemed to be acceptable. So how many of us have heard when a woman is raped, well, what was she wearing? Where was she going? So these types of norms that make the victim the responsible one for the violence that occurred. And that has implications in terms of women being willing to access services, whether they are legal or whether they are health services. So I think when we're talking about violence, it's really important for us to have this gender lens. Different forms of violence affect men and women differently, and that has implications for how programs can prevent and address these forms of violence.
And I mean, violence against women is traditionally been seen as a human rights issue. Why is it important for health systems to be involved as well?
Yeah, so that's a really great question, and I think the important thing for us to note is that the health system is already seeing women who are survivors of violence. We know that women who experience intimate partner violence or sexual violence, they tend to need more health services and to seek those health services. But they won't come to the health service saying, I experienced abuse and this is what I need. They'll come presenting the symptoms or the consequences of abuse and violence, whether it is recurring infectious diseases or whether it is an unwanted pregnancy, etc. And so if the health system is not prepared to identify violence, they're not going to be able to provide women with the services that they need. They won't be able to provide them with an adequate diagnosis and won't be able to help. If they are prepared to identify violence, they can intervene early, they can mitigate the negative effects of violence, and they can hopefully prevent that cycle of violence from continuing.
What can health systems do to address violence against women?
Yeah, so I think that there are many roles that the health system can take. I think the first one is to provide comprehensive services to survivors. But the health system can also help us to see this issue as a public health issue. And how do we do that? We have to gather information on the prevalence, the health consequences, the risk factors, and we also have to support prevention efforts. There are a number of new initiatives that are showing promising results in terms of preventing violence from ever taking place, and the health system has a role to play along other sectors in implementing these initiatives.
So lastly, as I said at the outset, approximately 1 in 3 women in the region are victims of this. Do we see that number changing? Is it? Are there certain countries where there's a stronger focus that we need to be looking at versus?
So there's a range of prevalence across countries, but also within countries. We have countries in the Americas where 53% of women have experienced intimate partner violence, whether it's physical or sexual. So there's a wide range, usually from about 17% to 53%.
Sure.
But those country level numbers also mask differences within countries, whether they are between rural and urban settings or across socioeconomic levels. Unfortunately, we don't have trend data to allow us to know whether it's decreasing or increasing. We have much better data than we had a few years ago. And I think in the near future we'll be able to assess whether the levels are going up or down.
Great. Alessandra, thank you very much for giving us a lot of insight into this very important topic and continued good work on this. Again, thanks for your time this morning.
Thank you so much. Yeah. Thank you for having me.
So our next topic is on antimicrobial resistance, which some people refer to as AMR, is when microbes are less treatable with one or more medications used to treat or prevent infection. This makes these medications less effective in both treating and preventing infection. Here with us today to join us are Pilar Ramon Pardo, Mark Sprenger, and John Boyce. We have a full lineup here today.
There is a change in the name of our last.
Oh, okay. So instead of John Boyce, we
Arthur Phillips.
Arthur Phillips. Thank you very much for joining us this morning. So Pilar works with us here at the Pan American Health Organization as advisor for antimicrobial resistance.
Okay.
Mark Sprenger is the director of AMRM Secretariat.
Narsul is coming in representation of the Ministry of Health.
Great, thank you very much.
From Barbados.
Yeah, thank you very much. So in terms of antimicrobial resistance, what is the impact, consequences of antimicrobial resistance in the daily life of people?
Okay, thank you so much for the question and also for the space. I think that this is a very important question that should be responded in different levels.
Sure.
So we will appreciate the comments from their country perspective, from Barbados, and also from the global level. So you will have a nice insight about the different levels of relevance.
Excellent.
So maybe you can start. Yes.
Okay.
Sure.
I'm thinking that it's probably not immediately apparent to the average person in the street the impact of antimicrobial resistance. They're probably experiencing the impacts without even being aware of it. So that they're going about their daily life. And for example, they may be consuming meat from animals that have been fed on antibiotics in order to reduce the rates of infection and to increase the rates of growth. An individual may be self-medicating for a condition that they assume is caused by bacteria, and therefore they've obtained antibiotics from someone else over the counter, and they are using these antibiotics because they believe that they will resolve a problem that they have by self-medicating. An individual may be even interacting with a healthcare provider and having been prescribed antibiotics, but they may have been prescribed antibiotics inappropriately and therefore may be at increased risk of experiencing resistance and consequences in terms of unresolved infections, other complications, increased length of stay, hospitalization, and knock-on effects in terms of cost to the country. So for a significant number of individuals, they may have no awareness that this is an issue that they're interacting with. But we can see how easily and how simply this issue may be played out just on a regular day in an average person's life.
Great, thank you. How would you like to add your perspective on that in terms of the impact and consequences of antimicrobial resistance in the daily life of people?
Yes, now if you look, modern medicine depends on the use of antibiotics. Yeah. It's very important not only to treat a patient with pneumonia, but also to prevent an infection if they get a hip replacement. Today we know that over 25,000 people die due to antibiotics that are not working in Europe, and the same amount of people in the United States, and a lot of other people die because they are not working.
Sure.
We also know that 50% of the antibiotics are not used in the right way. So you really need to reduce the amount of antibiotics that we are using. Now, I have 4 children myself, and of course they have often an infection. But if you just wait, you will see that they don't need antibiotics because a lot of infections are due to viral infections, and antibiotics will not work. So just wait and see. That's important.
Great, thank you.
And also it's important to mention that the implications are now, but will be worse in the future. So it's estimated that for 2015, the burden of antimicrobial resistance, the number of deaths will be higher than the deaths from cancer. So also we have to prepare ourselves for the future and to trying to protect the antibiotics because they are a social good.
So our time's a little bit limited this morning, but just real quickly, how can people, what can people do to contain antimicrobial resistance? What can they do?
Now, of course, only use antibiotics if they are prescribed by a doctor.
Yeah.
Just follow also the instructions, and you need to finish, your therapy.
Sure.
That's very important.
And I think the issue of packaging and getting those messages out there is very, very important, because individuals may not fully understand what has just been said so clearly, and countries and practitioners and institutions need to make sure that we communicate these messages clearly to individuals so that they understand them, and we need to ensure that we're constantly training providers so that they can appropriately counsel clients so that they can understand the benefits of cooperating and trusting in the providers in terms of appropriate prescribing.
Exactly.
Right. Thank you very much to each of you.
We was mentioned
really
to
appreciate your help and your
Exactly.
time with us this morning.
Okay,
and,
but we had very short time. We were thinking maybe 10 minutes, and also to mention the
I'm sorry,
campaign.
no, it's a we have to move on to the next topic. But thank you so much again. Yeah.
So thank you for the opportunity.
Thank you.
So thank you. It was very short, right?
Yes.
Like we couldn't find.
So our next topic is on high-cost medicines. And the issue of access to high-cost medicines has regained high visibility in the global and regional agendas. A side event at last year's World Health Assembly brought together member states and American Health Organization to highlight the challenges of ensuring access to these products posed to the health systems of universal health. In addition, integration and sub-regional mechanisms are taking joint action on this issue.
La primera, no la del medio. Al medio tú.
And UNASUR ministers of health agreed in their last meeting to devise joint strategies to improve access to health, high-cost and strategic products, and to include this topic as a priority in the recently signed agreement with the Pan American Health Organization. Here with us today are Analia Porras, who is our chief of medicines and health technologies here at the Pan American Health Organization, and Pedro Croco,
Yes.
who is the head of the Division of Diseases and Control and Prevention at the Ministry of Health in Chile.
Yes.
Welcome to both of you, and thank you very much for joining this morning.
Thanks.
How do policies and interventions such as the insertion of generic medicines, good management of intellectual property, and healthy technology assessment help to increase access to high-cost medicines?
The issue of high-cost medicines is rather complex, but we know that access to high-cost, effective, good quality products is a prerequisite to achieving a universal health. Thus, while there's no silver bullet, countries recognize that you need to have a whole set of comprehensive strategies that address this issue, starting from pharmaceutical policies and policies for health technologies that address the issue across the life cycle of the product, to good regulation and good procurement practices that allow us to, as I said, address the issue from all perspectives. Moreover, the issue of intellectual property and trade agreements also come into question, since some of these products are subject to some of the intellectual property and patent laws that create single source markets, and that will of course have an implication on the price of the product. Introducing then generic medicines when those patents expires and allow us to use competition to lower down the prices of medicines, it's a comprehensive and well-proven strategy to improve pricing, and then some of this high-cost medicine will become more affordable for the health system. I think in that way, Chile also has addressed this in a very well defined program through their law, Ricardo Soto, which is a specific program to address the problem of access to high-cost medicine. So I would like Pedro to comment on their new law.
Thanks a lot. Well, just mentioned, we just approved a law called Law Ricardo Soto that was named for a journalist who used to work in TV, and he died of cancer.
Oh, okay.
And he had a problem in the sense that he needed a high-cost drug for his treatment.
Sure.
And he was wealthy enough so he could afford it, but many Chileans could not afford that type of drugs.
Sure.
So we just, as I mentioned, approved a law that actually is going to give access to high-cost drugs to many more Chileans. And it's a universal in the sense that every Chilean has the opportunity to actually get financing by the law. And it is a really big issue because we are talking about some high-cost treatments that can cost in some cases something like $500,000 per person per year for their whole life. So no one can support that. And that's what the Ricardo Soto law is going to do in the future. And actually, we have been working with PAHO a lot, and we really thank PAHO for all its support. And we really have to deal with, as I mentioned, a big issue: how to deal with such drugs that cost so much in a world that has changed a lot. Because, for example, you enter the internet and you actually know at the moment that the FDA just approved a new drug, and everyone wants to get access to that drug.
So, Analia and Pedro, we only have another minute left, so real quickly, in your view, how can countries work together to increase the access to high-cost and strategic medicines? And let me just wrap in there real quickly, what can PAHO do to help achieve that?
So I think we have been working throughout the region in solutions that actually are comprehensive and have harnessed the will of countries to provide access. One, through both the revolving and the rotatory funds that PAHO manages for procurement of medicines and vaccines. We have made great contributions at lowering the price of certain products such as HIV, tuberculosis, and some of the most expensive vaccines. You mentioned at the beginning, the UNASUR countries and the Mercosur countries have actually signed an agreement to improve their pricing of certain products, but achieving joint negotiations for this product. But moreover, I think the fact that countries share information, share strategies, improve the communication, and bring together projects that work and share the results, it's also contributing to actually improving their knowledge and the way of management the problem of access to high-cost medicines.
Any last words?
Yes, I like to support that. We're small countries, and we are small markets. If we get together, we can get better prices, we can get better things for the industry. So PAHO is doing a great job on helping us on that, and so we are really grateful for that.
Okay.
Pedro, Analia, thank you very much for your time
this morning.
Thank you very much.
This was great. Thank you.
Thanks. Bye.
Súper bien salió.
Our next topic is on health-related law.
Mil gracias. Un gusto.
Gracias. Strategy supports PAHO member states in strengthening is appropriate to the respective national context. Greater coordination between health authorities, the legislative branch of government, and other authorities in formulation, implementation, or review of health-related law. Here with us this morning to talk about that is our very own Heidi. She Heidi Jimenez with a lot of experience in this topic, as well as Javier Vasquez. So thanks for joining us this morning. And if you could tell us why is it so relevant for the region to adopt a strategy on health-related law initiatives?
Mm-hmm. Well, thank you so much, Derek, for having us. We're very, very excited. Within the Office of Legal Counsel, we have during this last year promoted this strategy, which in our opinion is very, very important. And why is it important? The organization hasn't had a strategy on this area for over 40 years. The last resolution that was adopted was back in 1970. And we are now looking at a different paradigm, a different way of delivering technical cooperation and truly impacting our technical cooperation at the country level, making it effective and making sure that it's properly implemented. And in our opinion, one of the most important ways to ensure implementation not only of the technical cooperation, but in many cases, the legal obligations that many of our member states already have by way of treaties that they have signed, is through implementation of the corresponding law and the corresponding regulations that apply health-related policies. So this is truly, as we see it, a landmark. A landmark opportunity, and we're very, very excited to be able to work with the member states to have this approved.
Thanks, Heidi. Javier, what are the main lines of action of the proposed health-related law strategy?
Thank you. There are 4 lines of action that are promoting the right to the highest attainable standard of health in laws. And one of the main strategies, the lines of actions, is the better coordination between the legislative branch and the health authority in order to cooperate in the development of health-related laws. Another line of action is the promotion and development of health-related laws and regulations to promote health determinants of health, and also to promote the collaboration with other sectors of the government: education, transportation, agriculture. A third line of action is the promotion of health-related laws and regulations to reach universal healthcare and universal coverage. And this is a very important area because also health laws and regulations can promote access to medicines and technologies. And there is a fourth line of action that is the dissemination of health-related laws information in the context of the legislative branch, the judiciary, the ministries of health, also other ministries, through different tools and model legislations and other instruments of human rights law and international law. So the dissemination of health-related law among the different branches of the government is very important in this strategy.
Thank you, Javier. We're a little bit short on time today, so just the last question I'd like to ask you, just in terms of what is one of the biggest challenges in the region in terms of that we're facing in terms of health-related law?
Well, I think as Javier mentioned, one of the primary focuses of the organization right now is what we call universal health that relates to access. That is certainly one of our primary focuses. Additionally, given the importance of NCDs and the risk factors that really are having such a huge impact of the health of our continent, we are also focusing on risk factors related to health. So I would say those 2 elements are fundamental in our strategy. Of course, there's many other areas, but we wish to highlight at least those 2 areas. So it's universal access and risk factors and NCDs.
Javier, anything to add to that?
Else?
Well, I would like to add that there's an area where this reform of laws and the formulation of laws and regulations is very important, and is the area related to risk factors. And for example, how to use the tax legislative powers in order to protect health and also to reduce risk factors in the context, for example, of tobacco control or in the context of alcohol use. So that's another important area.
Sure. Javier, Heidi, thank you very much for joining us and giving us a lot of insight into this very important topic. And
thank you, Derek.
Continue
it's a pleasure.
Good work on this.
Thank you very much.
Very committed.
Thank you. Our next topic this morning is on workers' health. Workers' health is ill. Work and employment are social determinants of health and capable of imposing conditions that jeopardize workers' health. Occupational diseases, injuries, and death at work occur without being timely prevented, diagnosed, or treated, resulting in enormous underdiagnoses and under-registration. This is enhanced by the lack of access to health care and occupational health services and the coexistence of non-communicable diseases in adult working populations. Here this morning to join us and talking about it is Julieta Rodriguez, who is the advisor on workers' health here at the Pan American Health Organization. Julieta, thank you for joining us.
Thank you so much for the invitation today.
So why is it necessary, Julieta, to have an action plan that addresses workers' health in the region?
Because we have an old action plan that was designed back in the 90s, and the reality of the working world has changed very much, as well as the causes of injuries, diseases, and death at work. So we need to look at today how work and employment are social determinants of health and how they are influencing, and how we can intervene with a series of actions and activities to prevent this type of things in workers' health.
Can you give me an example of the actions that are covered by PAHO carried out by PAHO to improve healthcare workers?
Oh well, the health sector is a priority for us.
Sure.
And indeed, we have been working since probably 2006, where the crisis of health care workers was declared by WHO, and since then we've been developing a series of activities that are very important. Creating awareness, campaigns to prevent needle stick injuries, preventing hepatitis B, creating good habits at work, and promoting workers' health within the hospitals. We even made a manual for managers and administrators to teach them how to implement occupational health and safety programs within health institutions, and having coverage for 19 countries in the region. Nowadays we're striving to implement a new tool that has been jointly made by WHO and ILO, and we're working on them with ILO. So hopefully we will improve working conditions for workers' health.
What are the biggest challenges to improve workers' health across the region?
Across the region, well, our biggest challenge, I would say, is the informal sector, the informal workforce.
Can you explain that?
Yes, absolutely. Formal employment means we have an employer, we have a salary,
sure.
We have a contract. In informal work, you don't have an employer,
sure.
You don't have a contract, you don't have social benefits.
It's under the table, per se.
It's under the table, if you want to say it that way. And unfortunately, close to 54% of the region, of the regional workforce is under informal conditions. So it is an increasing. It's the consequence of poverty, it's the consequence of lack of employment, it's a consequence of many other things, and we don't want that to happen. So we have to intervene, and as health authorities, we need to address their health. We need to try to assure they have access and services in health, and for that, this is our biggest challenge.
Mm-hmm. Are there specific countries in the region where it's more of an issue in terms of the challenge than in others, or successes that you've had that you point to?
We have strong challenges in countries such as Peru and Bolivia, to mention a couple of them according to the statistics of the ILO. And we have very successful, in fact I come from visiting an experience in urban informality interventions done in the city of Bogota, and we found a very interesting experience how primary health care professionals were trained to move towards the informal urban sector, and they're making wonderful interventions, teaching auto-employers in very small units of work. We call them a small mini-scale enterprises, on how to do basic things to assure safety, to assure healthy work practices, and to teach them on how to comply and improve their conditions. So it's been really, there are many, this is just one example. In the rural work, we have an experience in Nicaragua that was very successful with the Asociación de Trabajadores de Nicaragua, that has managed to improve the working conditions of the rural peoples and to provide services for them. So yes, we have some beautiful examples and we have huge challenges.
Yeah. Well, Julieta, thank you so much for joining us this morning and giving us more insight into this really important topic.
Thank you so much for inviting us.
Continued good work on this, and
thank
look forward
you.
to collaboration in the future.
Okay, thank you very much.
Again.
Okay. Finito?
Our next topic is on safe food, and many of you have heard about food safety. We've been talking about that for most of this year. In fact, it was our World Health Day topic, and we've carried it on in other campaigns as well. It's an issue for everyone. Has a disproportionate impact on vulnerable groups, especially children, pregnant women, and the elderly. It requires action and good policies across the entire food chain, from production to consumption. Most of us think of food poisoning as a bout of nausea and diarrhea, but globally, more than 350,000 people die from contaminated food annually. In the Americas, about 1 in 4 suffers from an episode of food poisoning in any given year. This does not have to happen. And we, again, as part of the World Health Day message, which is do your part to ensure food that's safe from farm to plate. Here to join us this morning and talk about that is our very own Enrique Perez, and he is the Senior Advisor for Foodborne Diseases and Zoonosis here at PAHO.
Yes.
We've talked about this many times in the past. It's great to have you back and talking about this again.
Thank you so much for inviting me.
Sure. So Enrique, in terms of food safety, which it needs to be ensured throughout the food chain,
right.
From farm to plate, who's involved, what needs to be done?
Yes. Thank you. It's a very nice question indeed. Do you remember during the World Health Day that we have this promotion in terms of the do your part? And
Sure.
what means do your part? It means that producers, processors, distributors, retailers, consumers, everybody, all the stakeholders along the food chain has a responsibility in food safety. And this is exactly what food safe or safe food from farm to plate means, is everybody has to do their own part.
So what is PAHO doing to promote food safety?
Yes, well, PAHO has a regional program in food safety, which works with member states in 4 big programs, I would say. One is the legal basis, the legal framework. It's good that the countries should have a very nice type of legal framework because this is the basis of everything. The next big pillar is about surveillance and diagnosis. So the countries needs to have the capacity in detection and in response for foodborne diseases. The next one is inspection services. It says how to avoid the contaminants in food and works with the countries in terms of improving the inspections, the way that they improve how the food could be safe.
Sure.
And last but not least, social education and communication. This is basic. Everybody should know what is their part and what to do.
So there's another important food safety issue related to one of the resolutions to be approved by the Directing Council. Yes. Can you talk more about this?
Oh, yes, indeed. Yes, indeed. Tomorrow we will have in this house a resolution going about antimicrobial resistance. And one of the components is the use of antimicrobials in food-producing animals. This is a big challenge. I don't know if you know, Derek, but almost in some countries, almost 80% of the antimicrobials that are being used are used in healthy animals. And this causes, of course, selective pressures in the bacteria, resistance, and those bacteria goes through the food to the humans. So working with the farms, working with the producers, working with the veterinarians, it's in terms of the prudent use of antimicrobials is very important, and this resolution of tomorrow will take care of that.
Enrique, I know that it's clear from our work together on this that you're very, very passionate about this topic. And of course, we're going to be moving on to a new campaign for next year for World Health Day. But what can we do to kind of keep this top of mind in people's head, looking towards the following year? We obviously don't want to have this just be a one-year commitment to food safety, to be thinking about that. We need to kind of keep the message and the campaign going in some way. What can you do and what can we do to be thinking about that?
Yes, I would say that the continuous work that we do from PAHO with the member states are very important. Always creating the awareness, always talking with the countries in terms that they have to look for safe foods and relate the safe food with nutritious food. You know, we eat every day. We eat every day, so we are exposed to chemicals, to chemicals contaminants, to microbiological contaminants every day. So the point is, if we can build up this awareness in the persons and we can transmit that every day, will be the way to go. Also, the kids are they promote change.
Sure,
they promote change of habits in the person.
So is there something maybe you can just share with us real quickly? Is there something that you do personally in your life every day that could be, that we can relate to, that would be in terms of how you practice food safety?
Actually, is to practice the 5 keys for safer food.
That means
the first one is hygiene. Wash your hands. Do it correctly before you eat, before you handle the food. You have to wash your hands. You have to have the surfaces that where you do the cooking should be clean and should be out of contaminants.
Sure.
The next one is cook thoroughly. We have to cook thoroughly our food. The next one is to keep the temperature safe. That means if you have something that should be in the refrigerator, should be there to avoid the growth of the bacteria, right? And this is something that I practice every day at home. And last but not least, avoid cross-contamination. That means if you use a cut board, for example, to cut some meat, never never put later on some food that you will eat raw.
Sure. Very, very good tips, and always good to remember those kinds of things. Enrique, thank you so much for joining us this morning.
Thank you, Derek, for having me here.
Look forward to continue talking about this topic.
Yes, sure indeed. We will.
Important. So there you have it on food safety, and I'd like to remind you that we have the World Heart Day today, which is the Pan American Health Organization is joining the World Heart Federation and many organizations to remember the need of creating healthy environments to ensure that everyone has a chance to make healthy heart choices wherever they live, work, and play. Join us in the celebration of World Heart Day, a need to create healthy spaces. And that's it for today in terms of our English component. Please join us tomorrow morning at 11 a.m. Eastern Time for the Spanish language version of Social Good, where host Leticia Lin, who is advisor for media at the Pan American Health Organization, will join to moderate and speak with different guests about different important topics here at the 54th Directing Council. For the Pan American Health Organization, I'm Derek Fromson, and have a nice day. Thank you.